So this was a very different experience when I first came. Nothing I'd ever experienced before. Many times you'll feel like you could be anywhere in America. Like this could be where you're from. Other times you'll think, oh my gosh, this is nothing at all like where I've been or where I think I'm going to. You can sometimes say, oh, this could be upstate New York, some parts of it. And other times you think, what in the world? This is nowhere I've ever been before.
Because that experience at Frontier, just as it did with me as a young nurse, it stays with you the rest of your life.
That's right.
You can't ignore it. And then because you say, this is just a microcosm of most of the world. Mary Breckenridge set it up and called them the courier service because the most important thing was the communication. The communication between all the districts and headquarters and the hospital, between the nurses and the doctors, and transporting patients that needed to be transported. And in other words, to do all of the connecting stuff that made it work.
I really appreciate the smallness of the communities here and the opportunity to really explore the culture and values of the people, because you see a lot of them like over and over during the week, so you really get a sense of what's going on, and I don't know if that would be the same in urban populations.
Life here at Wendover is very quiet. We have quiet evenings, which is really nice to sort of have time to relax and absorb what we've seen during the day. I really enjoyed spending time with different practitioners and getting to see how different practitioners who come from different parts of the country and different walks of life sort of come about treating primary medical needs here in this area.
The clinic does a lot of different services, so I've gotten to see like food boxes and transportation and housing in addition to medical care.
This internship has confirmed for me that I really want to pursue a career where I'm interacting with people on a day-to-day basis and, you know, helping people in a personal way, not necessarily in a secluded way behind the scenes in a laboratory.
Yeah, I've been working with hospice as a secondary project, and we just go to people's houses and talk to their families about the resources that hospice offers and you know, what to do in case of an emergency and that sort of thing. And so that's been a really interesting way to see both sides of the circle of life this summer, where I've been attending births, but I've also been working with hospice on the other end of things. And I feel like the community has been so accepting of me just coming in as an outsider from Colorado, but you know, I get to be part of really private moments in the clinic and at the hospital and with hospice. So people have allowed me to be a part of some of the most intimate moments of their life, which has been really special and something that I was definitely not expecting when I came here.
Our uniforms, the khaki and white, that's such a symbolic, recognizable way for a courier to be in a community and be known as somebody who is there to serve.
1, 2, 3, and go.
You really just want some energetic young people who think they might want to go into nursing or midwifery or medicine, but they're not sure what they want to do, to bring them into the birth center as a volunteer. Just doing the ordinary stuff every day that needs to get done.
If an undergraduate student is looking to experience a summer of adventure and discovery about their country, the healthcare system in this country, and also themselves, that this is a challenging and interesting opportunity for exactly that.
What goes around comes around. What you give comes back to you in spades.
Mm-hmm.